Hello, my name is Nicolaus Kröger. I'm leading the Department for Stem Cell Transplantation at the University Hospital in Hamburg, Germany. And I will talk to you about the indication about allogeneic stem cell transplantation in multiple myeloma. So allogeneic stem cell transplantation, in contrast to autologous stem cell transplantation, has not become a standard care of treatment in patients with multiple myeloma. However, we have data that long-term data, allogeneic stem cell transplantation is a potential curative treatment approach for patients with multiple myeloma. However, there is still a pretty high therapy-related morbidity and mortality, so selection of the patient is very crucial. So there are some studies available in newly diagnosed patients comparing autologous transplantation with allogeneic stem cell transplantation. And in 2 of these currently 6 studies, there was a benefit in progression-free and overall survival. And the benefit seems to be most in patients with high-risk features, mainly defined by molecular or cytogenetic, mainly patients with p53 or translocation 414. In these studies, however, the transplantation has not become a standard care of treatment, probably because we have so many newer agents. So induction therapy has improved, autologous stem cell transplantation has improved. So currently, there is only for a minority currently an indication, I would say, for younger patients with multiple myeloma who have a high-risk cytogenetic, mainly p53, where you can consider preferentially within a clinical study an upfront auto-allo tandem approach. More critical, or probably more indicated in allogeneic stem cell transplantation is in younger patients who relapse after autologous transplantation. Mainly patients who have an early relapse after stem cell transplantation and have received a proper induction chemotherapy. But to be honest, even if the numbers we have in the European registry, in the EBMT registry, the majority of allogeneic stem cell transplantation in multiple myeloma are performed in patients who have already experienced relapse to an autograft. But there is no prospective randomized study so far, only some retrospective comparison or donor availability comparison. But in Germany, there will be started pretty soon a randomized study comparing as first salvage therapy after autograft failure, a triple combination with an allogenic stem cell approach to see whether allogenic stem cell transplantation has a role beyond the first-line treatment in multiple myeloma. So according to the registry data, we can report that in these patients, about 20 to 30% are still disease-free after 7-8 years after stem cell transplantation. To summarize the available data we have so far, for an upfront auto-allo approach is only useful for younger patients with multiple myeloma and high-risk cytogenetic features, preferentially within the clinical studies. So more indication is seen in first relapse after autograft, if it is an early relapse after autograft, while if patients who are 5th, 6th line treatment, allogeneic stem cell transplantation is not really indicated because in a later stage of the disease, the risk of relapse is pretty high.